Hello, welcome to Miki's Kitchen. Today, I'm going to continue where I left off last time. I'm going to tell you what happens when the blood sugar level gets high. Well, let's get started.
Continuously high blood sugar damages the blood vessels, and this can cause various complications. Three big complications: diabetic retinopathy, diabetic nephropathy, and diabetic neuropathy, are known as the first symptoms of diabetes. Diabetic retinopathy. Diabetic retinopathy is caused by damage to the capillaries of retinas. The first symptoms are the sense that you're seeing small bugs that don't exist, and the missing over your eyes with what resembles a black curtain. As the disease progresses, the eyesight gets worse and the field of vision becomes narrower, and it may finally lead to complete loss of eyesight. Diabetic nephropathy. Diabetic nephropathy is caused by damage to the kidneys. These are one of the internal organs that are most dense in capillary vessels, so when ongoing hyperglycemia hurts the capillaries, the kidneys are the first thing damaged and their functioning begins to decline. The kidneys filter out unnecessary substances from the urine. The first symptom of diabetic nephropathy is malfunctioning of the kidneys and the appearance of albumin in the urine. And then subjective symptoms appear, such as swelling, shortness of breath, tightening of the chest, and lack of appetite. Finally, when the kidneys stop working, dialysis is needed. Diabetic neuropathy. If hyperglycemia goes unaddressed, nerve cells and the blood vessels that supply nutrition to them both eventually become damaged. As a result, the nervous system gets out of order. When the sensory nerves become dysfunctional, it becomes harder to feel pain when you should, especially in the feet. If you hurt your foot but can't feel pain, the foot can easily become infected. In the worst case scenario, amputation is necessary. When the autonomic nervous system becomes dysfunctional, various functions decline, such as breathing, digestion, and perspiration. These complications are caused by damaged capillaries. If the diabetes progresses further, large vessels become damaged, and this is called arteriosclerosis. Arteriosclerosis is a condition in which blood vessels become hard and lose their suppleness, and it causes serious diseases of the brain and heart. To avoid diabetes, you should limit foods that contain lots of sugar, especially sweets. At the same time, it's important to consume foods that control the elevation of blood sugar. There are also some foods that help insulin to perform its function, and right now I'm going to show you this. Dietary fiber. As mentioned above, consuming dietary fiber before carbohydrates ensure that your blood sugar level goes up very slowly, and this saves insulin. Vegetables, mushrooms, and seaweed are all abundant in fiber. Dietary fiber is classified into water-soluble and insoluble varieties, and the water-soluble type especially helps control the elevation of blood sugar. It does by mixing with other food elements such as carbohydrates and slowing their absorption. Water-soluble dietary fiber is contained in barley, seaweed, konnyaku, and natto. Soy products. Soy products such as tofu, natto, and kinako or soybean flour are also good for stabilizing blood sugar. These foods improve the functioning of insulin, so they are especially good for people who have insulin resistance. Fish rich in DHA and EPA. DHA and EPA are contained in fish, especially the blue-backed varieties such as sardines, mackerel, tuna, and sorry. And they improve the functioning of insulin. They also make blood vessels soft and supple, so they help prevent arteriosclerosis, which is one of the complications of diabetes. You should make a conscious effort to have these foods on a daily basis. On my channel, I've uploaded instructions for making various dishes using konnyaku, natto, and other of the foods I've been discussing. You should take them out and try making them. Well, next time I'm gonna make a dish using one of the ingredients that controls the elevation of blood sugar. So, see you then!